The Concordia Health Connections Clinic in Winnipeg has been using an electronic medical record since 2007.
So an electronic medical record is essentially a patient chart. In most conventional doctor's offices, let's say even take it a couple of years ago, you would be looking at a file folder. So traditionally when a patient would walk into a room, a physician would pick up a file folder which has the contents of a patient's medical history and encounter notes, laboratory examinations, x-ray results, and prescriptions that they've had, everything being in a file folder. The electronic medical record is all of that housed in a computer. So the efficiency aspect of it is enhanced by having everything on one record on one screen and at easy access to the physician. Some of the positive impacts of my daily life using the EMR is increased efficiency. So to give you an example, when I'm seeing a patient, I have approximately 15 minutes to take a history, do a physical examination, prescribe medications if required, order investigations, and ensure that the patient's concerns are met. That isn't an easy task. And one of the challenges with that is the number of questions that can sometimes come to you as a physician, and you want to do a good job in answering all of them, but again, wanting to make sure that information is easily accessible.
At the Family Medical Center Clinic, Dr. Alex Singer also uses an EMR for his daily practice.
The problem with using a paper chart, as you can imagine, with the large volumes of data that we collect on patients, is this paper chart is difficult to access, it's difficult to find information in this chart, and it gets filed chronologically. There's no other way to file data in an electronic chart. This is where we are currently, this is where we should be. Using something like this, I can go in a clinical encounter and I can talk to a patient and I can access information in multiple different forms. I can search information based on dates as I do currently, or in a paper chart. I can search information based on a word, based on a lab value, based on any other types of information that's collected, and the richness of that data is tremendous.
The electronic medical record is gaining ground across the province as a tool of choice in physician clinics. Dr. Carol Holmes of the Agassiz Medical Center in Morden has been using an EMR since 1999.
Like we've been, I guess, 20 years, and patients' charts are really huge, and it can be hard to find if they've had certain tests. The imaging, like CAT scan, MRI, mammogram, depending on the way you file them, they can be quite easy to find. We have them filed such that I can open up a folder, CAT scan, and I can see all the CAT scans you've had done and quickly look at the results. It's much easier to find things. And there's less chance of duplicating things. Another thing I love about the EMR is the ability to manage my practice when I go away. I recently was in Ottawa for a week, and I was able to dial in over a secure network. I can check my lab results, look at diagnostic imaging, and manage my practice. I had a positive urine result that had come in, and I was able to message my husband, who's a physician, to take care of it, and he phoned in a prescription. There's also the job satisfaction, that I feel that you're doing a better job. Things like diabetes, it's much easier to be alerted to when they should have different tests done, because we have a good system that warns us that they're due for a foot exam and an eye exam. Before, I mean, it'd be pretty easy to miss that because they come in regularly, they might have a lot of issues, and you don't get down to some of these basic things.